is day 5 post chemo. I just finished my 3rd infusion, so it's the start of my 2nd round. We are definitely making progress. Really exciting. I like being able to mark them done. To be honest though, I'm just tired. I'm ready to be done. I'm sure that's normal for everyone. It's a mindset thing. I definitely, I'm actively trying to work on it every day. It's just, you get to the point where you're like, hey, I don't want to go sit in that chair. I don't want the pre-meds. I don't want to deal with it, but I have to, and it's for my healing. And so we're just trying to remain positive. Honestly, that being said, just, complaining for a little bit, the recovery for number 3 really wasn't that bad, at all. I think this has actually been my best recovery yet. And I don't know if that's obviously besides God and praying every day that recovery will just get better and better. Chemo is supposed to be cumulative. The fact that this recovery has been my easiest one was a huge blessing. And I also don't know if it's because the week leading up to chemo really focused on upping my protein, exercising, drinking water, all the things you're supposed to do to help your body recover. I actually feel like that could be a huge factor as to why recovery was so much easier. Side effects, the normal. Slept a lot the first 2 days, which was normal. Low appetite the first few days, again, normal, getting used to it, except this time I wasn't mad at myself for not being hungry. I just ate when I got hungry, tried to push through. It really wasn't that bad. The weekend went by pretty fast, and then normally by Monday afternoon, Tuesday, I start feeling more like myself again. My hunger gets back. Being more steady, it's a lot easier. Besides the fatigue and low appetite, the thing that I do keep forgetting to say, because it happens normally after I film these videos, but on day 5, 6, I start to get bone pain. It only lasts a day or two, but it's in my hips, sometimes my legs, and my shoulders. It could be a couple things. It could either be because I'm resting so much that your hips just get tired of constantly laying down, or it could just be a side effect of chemo. Muscle aches, bone pain could be a side effect. Honestly, pretty manageable with Tylenol. It's just a little uncomfortable, and it only lasts a day or two. Other thing I started doing, hopefully won't stop working, is I switched from coconut oil to biotin. I started doing that because it's hard to explain, your mouth gets sore, and it's not mouth sores. Luckily, I haven't gotten a mouth sore. It's just it feels tight and kind of uncomfortable, and your tongue just feels swollen. Biotin's been a huge help in reducing that. I just felt that was the way to go for me personally, instead of continuing to oil pull. The other thing is my white blood cell count has dropped, which is pretty normal during chemo. They say that they expect it in pretty much all of their patients, because that's what chemo does. That's part of it. And so I do have to be really careful. I can't have salads anymore. I need to make sure my meat's always cooked, just because my immune system, it fluctuates. So honestly, I think my levels were down, and then they went up, and then they went down, and that's just how it is. So I have to be extra careful about washing my hands, not getting sick, all of that good stuff. Overall, number 3 really wasn't that bad. Next Friday, I will finish round 2, so that will be number 4. And yeah, that is the update for now.